Hi, my name is Amy Skrober, and my clinical question is how does work-related stress among nurses affect them? In my first concept map, I have stress in the middle, and then everything affecting stress, or vice versa, could be ineffective coping, desire to leave their position as a nurse, PTSD or other mental health illnesses, compassion fatigue, and substance abuse. So this is how nurses usually deal with their stress and the outcome. I think this clinical question is important and or because we do see a lot of burnout with our nurses, and that can be related to trauma that they see or perceive in healthcare. It also has to do with taking that work stress home and how it affects their relationships with their family, which could include their partners, their children, or their friends. It's also important with interrelationships in the workplace and working with interdisciplinary team members, and also how the patient interacts or how the nurse interacts with the patient, especially if it does bring up some PTSD or other traumatic events that the nurse has taken care of with a patient in the past. The theory that I chose was the Sister Roy Calista adaptation model, and that model is all about finding concepts and identifications of yourself, and that includes your health, the environment, and your identity, and then taking whatever stimuli that's causing that poor coping mechanism and adapting it in a way that's healthy. So once we adapt that stimuli, we hope to have an intervention that adapts it and then gives you an outcome that is a healthy behavior out, healthy behavior outcome for the nurse. My conceptual model for coping strategies to manage stress among nurses is the nursing intervention. You'll have the nurse, and then nursing interventions is identify the self-concept group identify mode. So that's assist finding purposefulness in the universe and their identity. The other is the identify the role function model. So that's how the nurse sees themselves in their role as a nurse, as, say, a mother or a partner or a sibling. And identify the interdependence mode. And that's finding what kind of communication style is the most beneficial to their life, and giving and how they give and receive love, and what their moral values are. So the adaptation of stimuli is removing or decreasing the stimuli that's causing the maladaptive coping. And ways we can do this is by interventions such as debriefing, meditation, yoga, breathing, exercises, counseling, adequate sleep, focus groups, mindfulness, communication, skill training. And hopefully, by working through all of these adaptations and interventions, we'll have a behavior that's healthy coping and reduces the level of stress. So I believe that using these coping strategies will reduce stress by helping them either work out before or after, or make time to meal prep to reduce that stress, and also help them eat healthy, which will also help them with their mood and their interactions with others. Also, we know that working out and physical exercise is good for the brain and the body. And then other systemic approaches that we can take are having nurses working shorter hours, or hours that maybe they need to switch from a night shift to a day shift, and maybe there's a nurse that's more willing who maybe has a smaller family and adapting their work schedule to be more um, beneficial for their family and their lifestyle. What I want you guys to take away from this is that nursing can be a really rewarding um, career, but we do have the responsibility to build up resilience and take care of ourselves before we can take care of others. And the best versions of ourselves is when we're taking care of ourselves first, because that makes us the best versions of ourselves, which makes us the best nurses and caregivers that we can be.